and back in India. Uh, there are so many programs, but I would like to give some briefly some of the few programs that really we are doing several years. For example, we do have activities for youth, we do have activities for women, we do have health activities, spiritual activities, IT training, and auto matrimony, as well as emergency services we call auto SEVA, and auto foundation projects, which we do some community projects back in India. And recently, a couple of years back, we started auto youth scholarship. So, for example, for youth, recently we did one ATA webinar, which we call Seminar, on the topic how to make a drone. Really, the young kids, like between 8 years and 16 years, they avail this opportunity. And also for high school student, we are giving in the month of June SAT training. This is free to all ATA members. And women, we do conduct a lot of programs. Recently, we conducted online International Women's Day. International Women's Day we are doing on behalf of ATA last 7 years. This is a very our ATA own iconic event. Due to COVID situations, we are last year and this year we did only through online. But before that, we did conducted International Women's Day in several cities all around USA. And regarding the health, of course, we are doing as a part of the health committee driven program today, COVID-19 vaccine webinar, but we are doing free yoga sessions for all the ATA members. This is an ongoing yoga sessions, which we conduct every Sunday for 1 hour. So I really request everybody to avail this opportunity to get yourself know about yoga and ask all the questions and improve your health. As a part of the spiritual program, we are starting in April 14th, Bhagavad Gita sessions for the youth. So it's important our next generation kids should know about our culture, our spiritual information. So I suggest all the parents to encourage your kids to go through this Bhagavad Gita sessions. In the past, for the youth and adults who are in IT field, we conducted a lot of IT training. For example, past years we did Selenium training and artificial intelligence training. These kind of trainings are free to ATA members. And we are starting in this May another very good training, DevOps Boot training. So I would request all the ATA members to avail this opportunity. Besides this, I know we do have a lot of young boys and girls and parents getting married. They are in colleges. So we started a few years back ATA matrimony. This is exclusively for USA people living in USA. So you can avail that one, atamatrimony.com, atamatrimony.com. As I said before, we are doing some foundation projects which helps in community back in India, in rural villages, schools, and colleges. For example, we did in the past so many schools providing in India, like a digital classrooms, providing dual desk benches and mineral water plants for the schools and some infrastructure. So this year, a separate ATA Foundation committee, they raised a lot of funds and planning to do some help back to India. And a couple of years back, we started ATA Youth Scholarships. So approximately 10 to 15 scholarships each, $1,000. We are providing the scholarships to Telugu community youth going to colleges. So I would suggest please avail that one. And last but least, so ATA emergency services. This we call ATA SEVA, ATA-SEVA. So within USA, our Telugu community as well as Indian community, as a part of their life, they will be having emergency situations like accidents or any help they need. Students, sometimes hurricanes, fire happens in some apartments in different places. So they can always reach us to get help from ATA. There is a special phone number we have for that emergency help. That is 1844 ATA SEVA. I repeat again, 1844 ATA SEVA. Or you can email like a atahelp@ataworld.org. So with that small brief about ATA, I would like to invite, we have a special speaker today, Dr. Nikhil Bhayan. So he's going to provide presentation on COVID-19 vaccine, that what we all need to know. And Dr. Sujit Punnam is a ATA Health Committee Chair. So he's going to moderate this program. And we do have Dr. Shashank Ponugoti, he's ATA Health Committee co-chair. He is also there in this session. So with that brief introduction, I would like to invite Dr. Sujit Punnam to start the webinar. Thank you.
Thank you, Ramakrishna Reddy for that opportunity and introduction. Hi, viewers. We all are going through one of the biggest pandemic in the last century. And I don't need to give you an introduction about the COVID-19 because everybody is facing the wrath of it. But, the good news is on the anvil, there are a few updates that what we need to know about vaccines. We're going to talk to Dr. Bhayan and get answers for those questions. But there is definitely a bright side to this whole story at this point because the vaccines are working. We are getting some real world data from all over the world. And the rollout is improving. Yesterday's news was about 18 million people were vaccinated. 18% of the people were vaccinated by yesterday in the United States. And the next 3 to 4 months, it's going to be very much covering most people other than the children until and unless we get more information about the studies that are going on for the children. And then more therapeutics are coming in. The therapies for these monoclonal antibodies and all that are coming. New cases are coming down, deaths are lesser, but there's one catch to it, even though the vaccines are rolling out, is the new variants, the UK variant, the South African variant, and other variants that we could encounter can play a spoiler. So can you project the screen for me, please? So before I give it out to Dr. Bhayan, I just wanted to show you a couple of visuals to give you an idea about infection. What happens is, the next slide, please. So this slide gives you basically when we get infected, there is a lag period before the symptom onset is there. And then after that, body starts mounting responses in terms of antibodies. There are two types. One is the IgM antibody, which is an immediate, and a little bit later, IgG, so which carries through after the infection. As you can see, the red line, after the infection is over, the IgG antibody continues. We don't know for how long, but that is supposed to give you that immunity. The same thing with COVID vaccine. You give the COVID vaccine, mild infection situation is created, and the body mounts the response to it. Next slide, please. The good thing about the whole thing, whole pandemic this time was compared to the last biggest pandemic in 1918 of the flu pandemic. Our scientific world is much more advanced. So we were able to predict how the pandemic is going to pan out. This is a major marketing agency done a research study, and they got information from the scientists. And then in February 20, like exactly more than a year ago, they gave this prediction wherein what's the first peak is going to be, what's the second peak is going to be, when is the vaccine going to be coming out, and when it is going to be widely rolled out. So we are actually meeting that, whatever we predicted 1 year ago. So that is a good side about it. So cheers to the scientific advances that we have come to. So with that, I will invite Dr. Nikhil Bhayani to give you some brief presentation about the COVID vaccines. And after that, we'll have a question and answer session. Dr. Bhayani is an infectious disease specialist working for Dallas-Fort Worth Infectious Disease PLLC. He's advisor, epidemiology and infectious disease advisor for Texas Health Resources, and also an assistant professor at University of North Texas School of Medicine. Dr. Bhayani, thank you for joining us. If you can please take over.
Yep. Thank you very much. Good morning, good afternoon, depending on which time zone you live in. Thank you, and happy Easter, and thank you for giving me the opportunity to speak to such a large audience. And we'll go into the presentation. Could I have my slides, please? All right, next slide. All right, yeah, next slide. Next slide. Perfect. So in order to understand the role of the vaccine, we have to know what our immune system is doing. So for example, we have the illness. The illness is due to the invasion from the foreign body. Could be bacteria, could be virus. In this case, it's a virus that causes COVID, which is the SARS-CoV-2. Now, our blood contains red blood cells, which carry oxygen to tissues and organs. And also we have the white cells, which are the cells that help fight infection. These are our cells that make up our immunity. And within the white cells, we have subtypes of cells called macrophages, which are white blood cells that pretty much, they're like the garbage disposal of your immune system. They swallow up digested germs and dead or dying cells. The macrophages leave behind parts of the invading germs, which are called antigens. The human body recognizes these antigens as dangerous, and that's where the antibodies are stimulated. And the type of cells also that are responsible for producing these antibodies, they're called B lymphocytes. They produce the antibodies that attack the pieces of the virus left behind by the macrophages, and the T lymphocytes attack cells in the body that have already been infected. Next slide, please. So the first time a person is infected with the virus that causes COVID-19, it can take almost several days, as Dr. Poonam had explained. You can see it can take several days or weeks before the body can make and use all the germ-fighting tools needed to get over the infection. That's why if you've been infected by the virus, it'll take about anywhere from 3 to 7 days to see the full symptoms, the 7 days being the peak. And after the infection, the person's immune system remembers what they learned about how to protect the body against that disease. So the T lymphocytes, they have memory cells, which go into action quickly if the body encounters the same virus again. That's how vaccines, later on explain why they work, because our body here remembers that, hey, this is the virus, we have to attack it. That's why you have the antibodies and all that. And when familiar antigens are detected, the B lymphocytes produce those antibodies to attack them. Now, of course, right now there are studies underway that are determining how long these memory cells protect you from the virus that causes COVID-19. Next slide, please. Now, how a COVID vaccine works? Before I get into showing some pictures here, the COVID-19 help our bodies develop immunity that causes COVID-19 without us having to, get the illness. So you're getting vaccinated so that way you do not have to have the illness to fight the infection. There are different types of vaccines. They work in different ways to protect us. The common ground, all types of vaccines, the body is left with a supply of memory T lymphocytes, as well as B lymphocytes that will remember how to fight the virus in the future. It usually takes a few weeks, it could take 14 days after the first dose of vaccination to produce T lymphocytes and B lymphocytes. Now, of course, there's a caveat here that a person could be infected with the virus that causes COVID-19 right before or just right after the vaccination. And that's how people get sick, because the vaccine does not have enough time to produce those antibodies. It takes at least about 14 days. And usually the symptoms after vaccination, because it's a process of building immunity, it can cause normal symptoms such as fever, which is normal. And also, these are all signs that the body is building immunity, even though you feel slightly ill. Next slide, please. Now, these are the authorized and recommended vaccines. This is from the CDC. So we have 3 vaccines that are available under the FDA emergency use authorization. That is the Pfizer BioNTech mRNA vaccine, the Moderna, and the Johnson & Johnson. Next slide, please. So this is a cartoon of how these nucleic acid vaccines work. And if you look in the lower corner, you have the mRNA vaccine, how it works. So for example, you will have the mRNA segment that codes for that spike protein. It's encased in a lipid coating, which is injected into the human body, and it's taken up by the cell. And as you can see, the mRNA vaccine it does not affect the DNA whatsoever. It does not get to the nucleus of the cell. Rather, it gets onto the machinery of the human cell that produces the spike protein. It takes that genetic material, produces that spike protein. Rest of that mRNA fragment, the viral fragment, is discarded, has nothing to do with the body. And now the human body is producing that spike protein, which is presented to our own cells, the antigen presenting cell. And that's where you start having antibody formation. Next slide, please. Now, this is how the Johnson & Johnson vaccine works. What they basically have done, they have taken the gene for the SARS-CoV-2 spike protein, integrated that into another virus called the adenovirus DNA, and that is now injected into the human body. That DNA is taken up and you create the spike protein the other way there. And that is presented to the antigen presenting cell. And as we know, the Johnson & Johnson vaccine is 1 dose. Next slide, please. And this is the AstraZeneca vaccine, which has come up in the news, very similar to how, similar to Johnson & Johnson, the whole mechanism. It is taken up into, it's basically this, you have the DNA there that's taken up by this virus. Next slide, please. And this is the DNA inside that adenovirus. The adenovirus here basically now is injected into the human being. Next slide, please. So here we can see the vaccine enters the cells. They start producing the spike protein. The body's immune system reacts, produces antibodies, and activates T cells to destroy the cells with the spike protein. Next slide, please. And if the patient is exposed to the virus that causes COVID-19, antibodies and T cells are triggered to fight this virus, as you can see in this illustration, how it depicts it. So the Y-type figure is the antibody, You can see how they lace the spike protein, and then you have the T cells that are circulating there. So they are ready to fight the virus when you have been exposed. Next slide, please. And this is a summary of the 4 vaccines. Of course, like I said, the Pfizer, the Moderna, and the Johnson & Johnson have emergency use authorization granted by the FDA in this country. AstraZeneca is yet to apply for the emergency use authorization, but most likely they will be applying sometime this month. Next slide, please. And how effective are the COVID-19 vaccines? As you can see, that the Pfizer-BioNTech vaccine, the Moderna vaccine, I mean, we're talking almost 94, 95% effective. Now, keep in mind, these are, when I'm talking the effectivity of these vaccines, this is towards the wild type virus. This is not the variant. We will discuss that because there are more studies taking place. And of course, other vaccines that have been produced in the world, like the Sputnik 5 from Russia, almost 92% efficacious. You have the Novavax, and which is actually in phase 3 trials in the UK. And you also have the AstraZeneca vaccine, which is almost 70% effective. And the Chinese vaccine is almost 50% effective. Next slide, please. And this is the COVID summary slide here. This summarizes the 3 type of vaccines that we have. We do have the, so both the Pfizer and Moderna are your mRNA vaccines. Your Johnson & Johnson is the adenovirus, number of doses. The Pfizer vaccine, there are 2 doses given 21 days apart. The Moderna, 2 doses, 28 days apart. And the Johnson & Johnson is a 1-dose vaccine. And as you can see, how effective both the mRNA vaccines are, almost like greater than 90%, almost we're talking 95% efficacy after the 2nd dose. And here are the age requirements. Of course, as we know, Moderna has, and they have started enrolling adolescents in their clinical trials. Hopefully we'll have more information. But for now, Pfizer-BioNTech has been approved for any adolescent that's over the age of 16. For Moderna and Pfizer, both are 18 and older. Next slide, please. So the bottom line here on the COVID vaccine, getting vaccinated is one of the many ways you can protect yourself and others from COVID-19. The protection from COVID-19 is particularly important because some people can get COVID and it can cause severe illness or death. And stopping a pandemic requires all tools available. So vaccines work with our immune system, so the body is ready to fight the infection. And after you're fully vaccinated against COVID-19, you may be able to start doing some things that you had stopped doing right when the pandemic started. For example, visiting grandma, grandpa, traveling international, traveling to, holiday gatherings, going to concerts, going to sporting events. All these have come to a halt during the pandemic. But now with the vaccine rollout and more people getting vaccinated, we should be able to be on track to get our lives back to normal. And also keep one thing in mind, even though you've been vaccinated, do not let your guard down. You still have to adhere to public health guidance like masking and, of social distancing and avoiding large crowds, because there's a good chance there are folks who are unvaccinated and that you're definitely putting other folks at risk. Next slide, please. And as Dr. Fauci has stated this very clearly, that if it cannot replicate, it cannot mutate. Therefore, get vaccinated and follow the CDC recommendations to protect yourself and others from COVID-19. Next slide, please. And this is just hot off the press. As most of you heard, the CDC just right now released recommendations on vaccinated people who are planning to travel. And I know that summer is coming up. International travel is on everybody's mind. Of course, everybody is asking, oh, when can I start booking my trips, this and that. I've been fully vaccinated. Now, of course, the CDC rolls out their recommendations, and this is, I would say, this is a breakthrough when it comes to getting our lives back to normal. So, for example, as we can say, it used to be that if you were vaccinated and you traveled overseas, you would have to quarantine for 7 to 10 days. Well, that's no longer necessary if you're fully vaccinated. However, as you can see, the caveat here is that you still have to get tested prior to entry into the United States. And upon arrival in the United States, you have to have another COVID test within 3 to 5 days upon arrival. Next slide, please. For domestic travel, only thing that is required now, if you're fully vaccinated, self-monitor for symptoms, wear a mask and take other precautions during the travel. So you don't need to get tested. You don't need a quarantine. So at least from what I'm gathering here from the CDC, at least we're taking a step in the right direction here. Next slide, please. All right. Thank you.
Sujit, you're on mute.
Thanks a lot for the brief rundown on the COVID vaccines, Dr. Bhayani.
Thank you.
And I think that will set the tone for our discussion for this session. Most often asked questions you've already covered, but I'm sure there are a lot of people out there with lingering questions about what about this, what about that. We hear a lot about herd immunity. Can you tell our viewers what that is and to what extent the population has to be immunized against COVID-19 to get herd immunity in the country? And if the country is immunized to meet the goal, are we really safe, especially in this day of global village concept? Sure. With so much travel going on and all.
Right. No, and definitely that is the big question that does come up. So herd immunity is when you have to, the number of people in the population that have to have developed protection from the particular disease. That could be in the form of getting the vaccine, or it could be acquiring the disease itself. And obviously we know that, acquiring the disease itself, there's collateral damage associated with that, and that could even result in death. So that's why the vaccination is probably the best way to achieve herd immunity. Now, the numbers that we hear as high as 80%. That's like 4 in 5 people. But even as I think most of the literature that I have looked at, herd immunity can be anywhere between 60 to 70%. I would probably aim for the 70% in order to say that your community, your population is protected. Now, of course, the question comes up now with the variants. How relative is that herd immunity? How long is that herd immunity going to last? And that's where the studies with the vaccines and all that, we are against the variants, we will understand that a little bit more. But the bottom line here is to our viewers that even if you do get the vaccine, there is still some degree of protection against the variants. And it's better to have some form of protection than no protection.
Great. So among all the things that I earlier mentioned, the variant forms of the vaccine is probably going to be a spoiler, but even that, there is a silver lining to that, is some kind of protection is there. That's good to know. Now, what are the possible side effects that people can get from the vaccines, and what are
Sure.
the lethal complications that one could expect?
Right. So the most common symptoms after a vaccine, of course, is the injection site. You can have pain, redness, swelling around their injection site. Your muscles are sore. You can have fatigue. You can have malaise, and of course, fever, which I had described in the presentation. That's usually signs of the vaccine's working. Now, in terms of the severity or what severe complications there are people who have had developed like, rashes. They've developed like, oh, after I got the vaccine, I had some difficulty breathing, but that was only for about 30 seconds. And that could be because of histamine release. So usually we give these people Benadryl. However, the question that comes up, can I still get the second dose? Well, if you've not had anaphylaxis, you technically could get the second dose, but you have to do that in consultation with your primary care provider or an allergist.
Gotcha. So that's why, when patients ask me the question, I try and reassure them that, the reason why they ask you to stay in the immunization center for a 5 to 10 minutes after getting the dosage is if you were to have an anaphylactic reaction, which is an acute lethal complication of vaccine, they can easily give an EpiPen, like an epinephrine injection, and reverse the process.
Right.
So that's taken care of. So that's good. So if somebody had a reaction, allergic reaction, say they had an anaphylactic, the most severe form of allergic reaction that anybody could have from a prior flu shot, and they're avoiding flu shots since then, what about those kind of people?
So if they've had an anaphylactic episode with any of those prior vaccines,
right,
it is recommended to avoid the COVID vaccine.
Okay. To the extent that we know from the real world data that we are getting, how long do you think this immunity is going to last for us?
That's a very good question you brought up. Just on Friday, Pfizer just presented some long-term clinical data, and they said that if somebody who's been fully vaccinated, those neutralizing antibodies have been detected almost up to 6 months. So we're still waiting for waiting for it to be published in a peer-reviewed journal, but that at least is some hope from the clinical data that was obtained by Pfizer.
All right. So we probably will be right if we can say this will last at least for a year. Am I right on that?
Well, I sure hope so. I'm hoping that, we have that immunity for at least up to 1 year. But I think the silver lining here is, that 2 months ago, we were under the impression the vaccine, the antibodies last for 90 days. Now, 2 months later, with further studies, we found out that, it's good up to 6 months. And those are studies from the people who are in the clinical trials for the Pfizer and BioNTech vaccine. So hopefully, maybe we might get some 9-month data. And hopefully if you have some antibodies up to 9 months, hopefully we'll find something up to 1 year, hopefully.
Let's hope for that. So now, a lot of people ask another question, like, can I get a COVID infection if I get a COVID vaccine? Now, is that possible?
And I think the timing of that, it varies. And let's put it this way: if you have just received the vaccine within the first dose within 14 days, you still can get the infection. Not because the vaccine's not effective, it's just because the vaccine has not been given enough time, or your body does not have enough time to form antibodies. So yes, you technically could get the illness prior to the antibodies developing, and that can really open you up for an infection.
Gotcha. So we have another question from the audience. How do we know that these vaccines are safe? Could they cause long-term problems?
Right. So right now,
apart from the benefit that it gives, yeah.
Right. So of course, more long-term studies are needed. Keep in mind, these vaccines have been, been around, for emergency use authorization for at least 3 to 4 months. And, like I said, only time will tell. But overall, based on the history behind mRNA vaccines, they are actually relatively safe. So I do expect that you're going to see a lot fewer long-term complications compared to other vaccines.
Gotcha. So if somebody recovered from a COVID-19 infection, do they need to get vaccinated? If so, what's the time frame?
Yes, so definitely if somebody has had the COVID illness, they definitely should get vaccinated. And what we recommend is 14 days from the resolution of symptoms. So we usually want, and the reason being, we want the individual, their immune system to settle down because already they've had the infection, their body has been overwhelmed. So we want them to, it's sort of like, let your immune system take a break and then we'll get you the vaccine. So we would say at least after 14 days.
Say, for example, a person got severe COVID infection, got admitted to the hospital, was on the ventilator, breathing machine and all that, and they get discharged 3 months later. How about that kind of a patient?
Definitely. I mean, up to 90 days.
Okay.
That's perfectly fine. So anytime
Okay.
after 2 weeks, you definitely can go for the vaccine.
Gotcha. Can you still spread COVID after getting the vaccine? Like, kind of transmitting the disease? If so,
Right.
what extent?
So that's a very good question. That question comes up quite a bit, and studies are being done by Pfizer and Moderna on folks who have received the vaccine can be asymptomatic carriers of the virus. So even though you've been vaccinated and you're in a crowd that has not been vaccinated, that's why we still need to wear a mask, because there's still some degree of viral shedding. Of course, not as significant as somebody who's symptomatic, but still there is some degree of viral shedding. And one thing Moderna and Pfizer is looking at, does the carriage rate of the COVID-19, the virus that causes COVID-19, is it decreased? And so far, the carriage has been shown to decrease after vaccination.
Gotcha. Now, why do you think Pfizer and Moderna decided to do a two-dose study, whereas Johnson & Johnson did a one-dose vaccine study? Is it just a matter of chances that they took, or do you think there is real science behind it?
I think of course, it's a combination of both, but I think it's a science behind it. And the reason being, when these clinical trials are going on, they looked at the immunity. After the first dose, these people had 50% immunity after 2 weeks after the first dose. And then when they gave the second dose, 95% effective, which is really good. So that is what we, and that is my best guess. That's why they, in order to get this emergency use authorization, you want to have a bigger bang for your buck, and that's why the 2 doses versus the 1.
Right. And by that time, I think CDC already said they're not going to give an authorization if it's less than 50% efficacious.
Correct.
Now, another common question that people ask is, what is this efficacy? The 95% efficacy, 70% efficacy. Somebody says AstraZeneca is 64 in certain section of population, 84 in this, Pfizer is 95. Can you reassure our viewers about the concept,
Right.
why they should not wait for a specific vaccine? Because it has higher efficacy?
Right. So when we talk about higher efficacy, we mean that how efficacious it is to protect you from the viral illness, how effective it is to protect you from the virus that causes COVID-19. And now keep in mind, that's the wild type virus. The variant is a separate issue. And we'll have more information on that later on as more studies are evolving. So at this point, if I have one of these 3 vaccines available to me, go get it. Because I'll tell you, even the Johnson & Johnson vaccine, it's efficacious. If we take the flu vaccine every year, that seasonal flu vaccine is usually about 60, no more than 70% effective per annum. So these 3 vaccines you have out there, you can't, I mean, they're great. Can't go wrong.
Right. Yeah, and then all these vaccines, you know, even though they're 70% efficacious in overall terms, if you look at, like, you know, deaths prevented or serious hospitalizations prevented, almost everything is 100%. So
Correct.
even if they get an infection, it's going to be milder variant. So getting a vaccine is important rather than wait for a specific one. Yes.
Correct.
Am I right? Okay. So now springtime allergies, an viewer has a question. Can they get a vaccine if they have springtime allergies?
Yes, they can.
Okay. How about pregnant and breastfeeding women? Can they get a vaccine? And what's the real world data that we have so far?
Right. So in these clinical trials that were done in Pfizer and Moderna, you know, there were not very many pregnant women who were enrolled, but the pregnant women that were in these trials, the vaccine was safe. And I am going to tell you what the CDC's recommendations are and the Infectious Disease Society of America, that if a pregnant woman chooses to get the vaccine, definitely you should consider it. However, please consult with your OBGYN.
Gotcha. I was reading somewhere the literature. We already crossed like more than 500,000 breastfeeding or pregnant women that got vaccines, and they're doing wonderful.
Yes.
So somebody has rheumatoid arthritis or some immunological condition, they're on Remicade or something like that, immunosuppressants. Can they get vaccine?
They can, yes.
Okay. How about HIV patients? Can they get a vaccine?
Yeah, so those HIV patients whose CD4 or T cells are over 250, they definitely can receive the vaccine. And I've had a few HIV patients in my practice who have received the vaccine and have done very well.
Okay, so a lot of subset of people are asking different, can I get it? Can I get it? I have this condition. Now, is there anyone that should not get a COVID-19 vaccine?
You know, I cannot think of anyone who cannot. I mean, the only people I think that cannot get the COVID vaccine are like the folks who are, especially the Pfizer vaccine, if they're under the age of 16, the Moderna, if they're under the age of 18. But otherwise, folks who are older, who have chronic conditions, these are the people who you want to get vaccinated. And the only people I could imagine who would not be able to get the vaccine are those who have had anaphylaxis to the other vaccines that they have received before.
Gotcha. Now, I know that we all know that vaccines are being studied right now in the kids less than 16 years of age. When do we expect these to come to fruition, that we can expect our kids to start going back to schools without the fear of them getting infected?
I will tell you that based on the data that is going to come out, especially in the school-age children, elementary, junior high school, I can tell you we'll start seeing more and more junior high school students vaccinated come this fall.
Okay, that's good. At least for the new school year, we'll be ready for that. So we keep hearing, some people say, oh, side effects for this vaccine is high. Don't take that, take this, like Pfizer, Moderna, or something like that. So is that real, or does it matter even if it is a little bit of side effects, mild side effects are higher for a particular vaccine? Does it really matter?
It really does not matter. I mean, when I look at the side effect profiles, when you put them side by side for Pfizer, BioNTech, Moderna, it's almost very similar. Of course, sure, in the Moderna trials, some people had a little bit more fatigue, fever, rigors, chills, more so than Pfizer. But honestly, across the board, it's going to be the same.
Gotcha. So now our main spoiler at this point are the potential variants that we are hearing: the UK strain, the South African strain. So do we know to what extent that have already come into the United States? Because the practice where I am in, the town where I am in, we already had 10 documented cases of UK strain. And I'm sure there'll be another 10, 100 times more in the community with that.
So right now, of course, the predominant strain, especially we're seeing this up in Michigan, the predominant strain there is the UK variant. Of course, in Southern California, they had 2 new variants there that were identified in Southern California, and variants in New York. So that's something that we have to be vigilant about. We should not be complacent. Even though we're vaccinated, still, this is why we need to still adhere to the public health guidance until we know, how long is herd immunity going to last, or have we achieved even herd immunity?
Gotcha. So another thing is gatherings, right? So CDC has given some guidelines. You did mention something about the travel, but about conventions and marriage gatherings and, parties and all. What is the number that they're allowing right now?
I mean, they haven't given a definite number, but of course, I think it's up to the facility, the individual. I would recommend just keeping a limit the crowd. I mean, at this point, unless if everybody who shows up and everybody's been vaccinated, just because you really don't know what type of crowd, what type of audience you get. Ideally, you would want to keep these gatherings under 100.
100, yeah, that's what I heard. And especially if all of them are vaccinated,
right,
it's even better.
Yeah.
Right. So after a first dose, for some reason, it's either 3 weeks or 4 weeks for Pfizer and Moderna vaccines. If for some reason they cannot take it and then they have to wait for another month, does it matter?
So let me see if I understood the question correctly. So let's say if I got the first dose,
right,
and for some reason there is an interruption, do I need to restart the vaccine series? Is that correct?
Yeah. Do I have to restart the series, or it's
right,
just okay to take the second doses later? Yeah.
Right. So, initially when it came out, it was, literally 21 days for Pfizer, 28 days. But now the CDC has given a grace period of up to 6 weeks in between doses. So for some reason, I could not get the second dose within that 21 days for Pfizer, 28 days. I can stretch that out up to at least 42 days and still have the same effectivity. And also the other question that was asked, well, what happens if it's beyond 42 days? One of the vaccine experts from the CDC emailed us and said that, it doesn't matter. You don't need to restart the series. Just get it as soon as possible.
All right. So yeah, I heard in the UK, the government policy was to get as many first dose vaccines as possible, rather than give 2 doses for a certain set of people.
Right.
So that's why AstraZeneca, it was supposed to be 4 weeks, but they're stretching it to 6 weeks, 8 weeks, 12 weeks. And even in India, they're doing that actually, so that they could cover more first timers.
Right.
So, so I will invite Dr. Shashank Panagoti. He has a set of questions, looks like he's covering from the viewers.
Yes. Yeah, that was a great presentation, Dr. Bayani and Dr. Poonam. And yeah, for our viewers, I know we have a few more set of questions. It's like, yeah, I think you have answered most of those questions. And can any patient with immunosuppressant, can they take the vaccination? Those who are on immunosuppressants like Remicade, infliximab, any of those medications?
Yeah, definitely they can. The only thing I will suggest is, they should at least wait for about 10, 14 days after the Remicade infusion, just going back to the thing that, you want everything to settle down before you give it. And that's what they usually recommend. And along the same lines, I'm going to answer this question because this has come up a lot of times in my practice, and I'm sure in your guys' practices too, that, oh, I got the flu vaccine today. Can I go get the COVID? What's the earliest I can go get the COVID vaccine? So if you've received a vaccine, another vaccine, you should wait at least 14 days before you get the COVID vaccine.
Right. So yeah, for those who have got the Remicade or any vaccination, we need to wait 14 days before we get the COVID vaccine.
Correct.
Yeah, great. That's great. And how about some patients with immunosuppressed diseases like HIV, and activates, or on anti-HIV medications? Can they get vaccinated?
Yes, they can. And I have quite a few of my HIV patients who are well controlled on their highly active antiretroviral therapy, who have received both. They're fully vaccinated, as a matter of fact. So yeah, there's no reason for them not to get it.
Great. Excellent. So, is there anyone who should not get COVID-19 vaccine?
Anybody who has had anaphylaxis to any of the other vaccines.
That's great. And I think so. Now with a lot of rumbling going on with mutant strains from UK and India and some few places in United States, how does these vaccinations are effective towards those? Any of those better? Any of the vaccinations are better for those mutant strains or not?
So right now, the one that has come up in the forefront has been really looked at has been the UK variant, and Pfizer, Moderna, and to some degree Johnson & Johnson. But of course, Pfizer and Moderna have pretty good activity against the UK variant. Just recently, I've heard that there is some degree of neutralizing activity against the South African variant for the Pfizer-BioNTech. But of course, more studies need to be done. But the take-home message here for our viewers is that even though you've been vaccinated, we say 95% efficacy towards the wild type, there is still some degree of protection against the variants. It might not be 95%, it could be a little bit less. It could be 75%, it could be even 60%. But you have some degree of protection.
That's
if
great.
somebody has a side effect, Dr. Bayani, say for example, they got a vaccine and they have some side symptoms, and is there any way that they can report that to the CDC? Because CDC would like to know about those information to keep tab of what's happening, right?
Right. So one thing that is recommended is that you have to notify your vaccine provider, and your vaccine provider then will file a report with the CDC, which is called the Vaccine Adverse Event Reporting System, VAERS. And it's on the CDC's website. You have to notify your clinic or the provider who gave you the vaccine, and they will report that to the CDC immediately.
Gotcha. So if somebody's visiting from India, the parents are visiting, where do they, they want a vaccine? Is there any way they can register? And in general, where do people register for the vaccines?
Right. So you would want to go with your local health department, whichever county you live in, because they're the ones who have received the allocation of the vaccines from the state, which of course was given to them from the federal government. So it depends on the county you live in.
Gotcha.
Okay, great. One of our viewers have asked a specific question. I'm sure you answered some part of it earlier. Like, we can extend the second dose up to 42 days. One of our viewers asked a question like, what if I get a second dose at 8 weeks? Will I have any side effects? Would it be okay to get a second dose at 8 weeks?
Yeah, that should be fine, And I'll tell you, going back to that question, this is where people say, hey, you know what? I get the Johnson & Johnson, one shot, I'm done. But the problem here is that, if you sign up with your county, if they have a large allocation of J&J vaccine, then great. If not, then you take what is available.
Right. It also depends on the logistics, right? Because Pfizer, we all know that has to be stored in extreme cold temperature.
Yes.
And you need to have specialized refrigerators for that, whereas others are not that so stringent. So
yeah,
based on that, the allocation is happening. Yeah.
Right.
And will there be any choice between various COVID-19 vaccines that I can choose and take?
So I think it just reiterating that it just depends at your provider. I mean, what choices they have, So, at this point, if you have the opportunity to get a Pfizer vaccine, get it. If you have the opportunity to get the Moderna vaccine, get it.
Great. That's great. Yeah. And I think some part of it is also.
Yeah, a vaccine is better than no vaccine. Getting a vaccine is better than not getting it. It's like going without a vaccine. So
yeah, that's great. And one of our viewers also asked a question. Now, I got a first dose of vaccine in India. So can I get the second dose? I was coming to US, and can I get the second dose in United States of a different vaccine?
That's a very good question, and that would depend on the provider, the vaccine provider, because we really don't have much data on that. However, the only thing I can comment on that we have had people who have moved from out of state, they got one dose of the Pfizer vaccine. They might not remember which brand. So when they come here, they're like, oh, I'm due for my second dose, and I'm not sure what vaccine I got. I misplaced my CDC vaccination card. So in those dire circumstances, you can give a second, Moderna dose, you can mix and match, but it is not a practice that is recommended. So if somebody is really in need of a second dose and they don't know what they got, but and I can't comment I don't know if there are mRNA vaccines yet in India or not, because the most common is the AstraZeneca. You really don't want to be mixing and matching two different products. This is a DNA vaccine, this is an mRNA vaccine. So you really would want to talk to the person who is administering the vaccine.
Yeah, that's great. Yeah. And is it okay to take over-the-counter pain medications after I get a COVID vaccine, like Tylenol and ibuprofen?
Right. So one thing that is recommended is that, there are people who think like, I'm going to pre-medicate myself to before I get the vaccine. That's not recommended. After you get the vaccine, if you have mild symptoms, do the best you can to avoid Tylenol and ibuprofen, but absolutely, if you need to take it, go ahead and take it. But I would not recommend taking something around the clock just because you're suppressing the development of immunity towards the vaccine.
So
And
it's better if they have to take something for symptoms, is it better that it is going to be a Tylenol rather than a Motrin?
I would
Because
say
Motrin
Tylenol,
is an
start off with that.
anti-inflammatory.
Right,
Yeah.
start off with the Tylenol.
Okay.
That's if you absolutely need it.
Right.
And so, yeah, and also after taking vaccination, what would you suggest about continuing to follow the safety precautions? Should one of our viewers said, like, should we continue to follow safety precautions like wearing a mask and everything after taking vaccination?
Yes, you do want to adhere to those recommendations. You need to wear a mask because, like we have said, that still we're getting there, but there are a lot of folks who are unvaccinated. So you want to do everything you can to protect others.
And so one of the viewers have said, like, I got exposed to COVID-19 patient and I'm watching for symptoms and scheduled for vaccination 2 days from now. Should I go ahead and take that? And now that I'm not sure if I'm going to get infection from the COVID-19, and is it the right thing for me to do, or should I just wait and reschedule?
So if you've been exposed to somebody with COVID, you've not been vaccinated, and you're due for the vaccine, I would wait for about a couple of days before getting the vaccine, because let's say 2 days after exposure, you start getting, let's say at day number 4, you start getting low-grade fevers and all that. It will create a little bit of, confusion that is my illness due to the vaccine or the exposure. So I would wait for at least a couple of days after exposure and get the vaccine, just to make sure that there's no signs or symptoms.
Like you would suggest to wait like the full 2-week period completely, like when to see if they are.
I would say wait for at least 7 days, the most, because usually we start seeing symptoms develop on day 4, day 5, with the peak being day 7.
Okay. So now what is the cost associated with the vaccine, Dr. Bhayan? My understanding is it's supplied free of cost by the federal government. Is that true?
That is correct. So right now, the vaccine allocation that we have, it's purchased by the federal government. A third party actually handles the distribution. And the reason for that is it's still under emergency use authorization. Once this gets full FDA approval, then there will be a cost associated, and that will be in the hands of the manufacturer.
Gotcha. So that's probably. And then there is a sizable segment of the population that have, valid concerns from their standpoint, about the trust they don't have in the way the studies were done, or the pharmaceuticals have, their own biases in coming up with, encouraging data. They are arguing, actually. Sometimes when you're talking to the patients, they're arguing that, that thing happens. And so anti-vaxxers are being called. So how do you deal with that situation?
That is probably that's the toughest crowd to deal with. And
right
at this point, if they choose not to get the vaccine,
Right.
then just tell them, hey, you need to keep wearing your mask, and you need to follow the public health guidance. Just because you're a firm believer, you're not wearing a mask, and you don't want to get the vaccine. It's just like during the flu season, there are a lot of folks who don't want to get the flu vaccine who are healthcare workers, so they wear a mask during the flu season.
Right.
So same thing over here. You just have to reemphasize the public health guidance.
Right. Because if we have to reach herd immunity by vaccinating about 70% of the population, the kids under the age of 16 are not being included right now. You take them off, and then about 30% or 40% of the adult population stay away from vaccines. There's no way we can reach herd immunity, right?
Well, let's hope that majority of those adults, after they hear this presentation, they change their mind. But you do bring up a good point, because in children, just recently in one of the pediatric infectious disease journals, they mentioned that some of the elementary school kids had circulating antibodies towards the virus that causes COVID-19. So that's very interesting that they probably might have been exposed, probably never knew about it. And then when they were in this study, found out that, there are children who have circulating antibodies. So there is a silver lining there.
Right. Yeah, great. That was pretty good, going over the common questions and answers. And thanks again. And I would like to invite Dr. Ponugoti again to give the vote of thanks.
Yeah, excellent presentation, Dr. Bhayan, and you have covered very well with respect to the COVID vaccinations, and we've been going through the deadly pandemic for more than a year, and your presentation of the vaccines was excellent. It covered everything, the anxiety towards infection and anxiety towards which vaccination we should take, and the side effects, and it kind of gives a sense of assurance for our viewers, and it has cleared many of the anxiety and questions for our viewers. And that was a great presentation, excellent presentation, and thank you so much. And thank you, Dr. Poonam, for moderating this presentation, and it was excellent. And thank you, Dr. Ramakrishna Reddy Garu, for arranging this presentation, and thank you, Ata, for making this presentation accessible to all our Telugu viewers, both in the United States as well as in India. And I thank ATA President Bhuvanesh Bujala, and thank you ATA Executive Committee, and thank you ATA Board of Trustees, and lastly but not the least, thank you Mana TV and TV5 and ABR Productions for providing the live version for our viewers, and give them an opportunity to ask questions. And also I thank from ATA ABR production team for technical support, and overall it was definitely helpful and reassurance for our team. And thank you so much, and it was really a great presentation.
Thank you very much.
Thank you all.
Thank you so much. In fact, I'm going to take my first vaccine tomorrow.